So we need sleep to carry on that 24/7 functioning. And sleep is an integral part of our life. So what happens during sleep, certain processes slow down and certain processes actually pick up. To name a few, there is definitely a conservation of energy during that time. So the metabolism goes down, the body temperature goes down, but certain very vital processes are happening. If you don't have enough sleep, the accumulation of certain neurotoxins in the brain can lead to diseases like dementia. Because studies over studies, it has been demonstrated that people who sleep less than 7 hours, for example, or closer to 6 hours, or even less than that, in general, they have more risk of metabolic syndromes like diabetes, uncontrolled hypertension, which, if run for 10, 15, 20 years, leads to increased risk of coronary artery diseases, congestive heart failure, even stroke. If you are not doing this, you will have a cognitive decline ultimately. You will not be able to be vigilant enough during the activities you are doing. Your memory may have lapses. So sleep that is cannot be paid with those weekend naps. Studies have shown if you take, for example, a double espresso 3 hours within your sleeping time, it does reduce your REM sleep. It increases your sleep latency, decreases your sleep efficiency, and does cause more sleep fragmentation, just like alcohol does.
All right, welcome everyone. Welcome to our second episode of the Homeostasis Podcast. Today we are lucky to have Dr. Tashfeen Mahmood with us. He is wearing the hat of a sleep medicine expert today, but he has multiple hats. He is board certified and trained in pulmonology. He's also board certified and trained in critical care medicine. And of course, all these trainings after his initial internal medicine training. He's also certified in sleep medicine. He was the director of sleep lab at University of Texas in Tyler, where he was also involved in teaching. And he moved to Lake Charles in 2020, where he's working at St. Patrick's Hospital now, where he's also director of sleep lab, director of smoking cessation program that hopefully we will discuss another day. But today we want to pick his brain regarding his expertise in sleep medicine and see if we can get some insights into what constitutes sleep, why is it important, and what are some of the medical disorders that can affect your sleep. So hopefully you will get some value out of this podcast. Welcome, Dr. Tashfeen Mahmood.
Thank you, Dr. Awan. Thank you
All
for
right.
having me here.
Yeah, thanks for taking your time out. I know you're traveling tomorrow and you're busy with packing and finishing your clinic and seeing patients today. And I know you were crunched for time. So we appreciate you joining us today to share your expertise with us and our audience. So really appreciate you taking the time out to be with us today.
You're welcome, Dr. Awan. Happy to help. Always.
Yeah. So some of the audience may not know we were actually friends growing up. We were together in middle school, high school, in a boarding school for 5 years. So we are also very close friends. So I had to use my old friendship as a bargaining chip to get Dr. Mahmood to help us out today. Dr. Mahmood, in your own words, would you tell us about your expertise? What are you doing these days? And what are your areas of interest? And then we can go on to some specific questions that our audience may be interested in.
Thank you, Ahmad. So I'm having hybrid of my practice. It's a hybrid practice with pulmonary critical care and sleep medicine. I have been offered jobs where people have asked to focus on one of those fields, but just because I like doing everything, I have kept everything alive. As you said, I'm director of sleep medicine, so I run a sleep center here. I established a sleep lab when I moved here, established a lung nodule program here. So in addition to sleep, my interest is in lung cancer. So basically raising awareness of lung cancer screening and early diagnosis and changing the survival curve towards early detection and getting a lung cancer nailed away in the right time when improving survival has been the goal. I also cover our ICU here, so having taking call every other week. So it's been busy last 5 years, but this is what I like doing. And so basically doing everything and helping our patients with pulmonary diseases, critical care, and sleep-related problems have been my
And I know you're
mission.
one of the most popular doctors in Lake Charles because my brother lives in Lake Charles and everyone is always talking about Dr. Mahmood. They need your time one way or the other. So thanks for doing that for the community. Yeah.
That's true.
So do you find,
For some
I know
other
you have
reasons.
some interest outside of medicine too. So you have picked up pickleball recently, and for the interest of our audience, I know Dr. Tashfeen has an amazing voice. He's a great singer. So if you ever run into him and you want to listen to some Pakistani Indian songs, he's the guy to go for it.
You're giving it all away now.
Yeah.
My pickleball skills are not better than yours.
Well,
We
you
learned
taught
it last weekend.
you taught me. All right, so let's dive into our topic for today. So sleep. We'll start with the basics. The goal of our podcast, it's a new podcast, and you may not have listened to a couple of other episodes that we recorded, but the goal of our podcast is to educate the non physicians about how the physicians are thinking when they run into these problems. So we had discussion with one of our psychiatrists a couple of weeks ago. What are the psychiatrists thinking when they are dealing with the problems that you bring to them? And today we want to see what is a sleep medicine specialist thinking when he or she or it is dealing with the problems with sleep. So we start from the basics. So we have some scientific foundations of how things work, and then we can delve into some of the clinical problems. So the first and the very basic question is, why do we need sleep?
All right. Emma, this is a very good question, and everybody asks me whenever I go deliver those talks locally and nationally. And I always give an example of a machine. If you have a machine that has to run 24/7, you can't stop the machine, but at least you can slow it down. So certain parts of that machine slow down, certain parts continue to work, certain parts stop, but the machine keeps running. That is human body. So we need sleep to carry on that 24/7 functioning. And sleep is an integral part of our life. So what happens during sleep, certain processes slow down and certain processes actually pick up. To name a few, there is definitely a conservation of energy during that time. So the metabolism goes down, the body temperature goes down, but certain very vital processes are happening. For example, consolidation of our memory. There are different kind of memories that we learn during the daytime, certain important phone numbers, account numbers, or we learn something called part of memory, like learning a bicycle, learning how to play piano. These things are being consolidated during sleep, and sleep is very important to prune those memories. So also brain gets rid of unnecessary things during our sleep. Certain waste products are eliminated during sleep. We have a system in the brain called lymphatic system, which clears certain neurotoxins during sleep. And that process is actually at its maximum pace during sleep. And if you don't have enough sleep, the accumulation of certain neurotoxins in the brain can lead to diseases like dementia. In other ways, certain reparative processes are happening during sleep. For example, certain hormones are released more during sleep. So they have a circadian rhythm. So in 24 hours, they have ebbs and flows. And certain peaks are happening only during sleep. For example, growth hormone. So it is very important that we get our nervous system some resting and some reparative process during the sleep. We know if we don't sleep enough, we have difficulty in remembering things, difficulty in concentration. So certain cognitive functions decline. Certain learning abilities are preserved with adequate sleep. In addition to that, certain hormones, for example, cortisol, it is suppressed during sleep, which is important because you need to cut down all that energy and preserve that energy to carry on the reparative processes. So sleep is very important. And this is the basis of sleep. So certain things slow down, certain things completely stop, and certain things continue to work as they would. Heartbeat. Blood pressure has a natural dip in sleep. Heart rate has a natural dip in sleep. So imagine your heart has to work 24/7. You can't stop it, but it has to slow down. Your blood pressure has to dip down. And sleep is the most important time. It's a vital time during which these physiological changes happen. So that is the basis.
So you pretty much partly answered my next question. So what's going to happen if you don't get enough sleep? So you're going to have trouble with your memory. You're probably going to have trouble with your cognitive capabilities, especially long-term cognitive capabilities. You may have trouble dealing with stress the next day. Anything else that happens if you're not getting enough sleep?
I'll take your question is what is an adequate sleep? Okay. So uh, the sleep, there is a sleep quality and there's how much sleep you're getting. So if you have roughly around 7 to 8 hours of sleep, it is considered in bigger trials adequate for not only your nervous system health, but also your cardiovascular and metabolic health. Because studies over studies, it has been demonstrated that people who sleep less than 7 hours, for example, or closer to 6 hours, or even less than that, in general, they have more risk of metabolic syndromes like diabetes, uncontrolled hypertension, which, if run for 10, 15, 20 years, leads to increased risk of coronary artery diseases, congestive heart failure, even stroke. And if you have a sleep of more than 8 hours, closer to 9 hours or beyond, that is also pathological and is associated with increased cardiovascular comorbidities. So, roughly 7 to 8 hours is good. And we know that in addition to those things that we just mentioned, growth hormone spurt, your cortisol level decline, your core body temperature where it is, your immune system is bolstered during that time. If you are not doing this, you will have a cognitive decline ultimately. You will not be able to be vigilant enough during the activities you are doing. Your memory may have lapses. So it is very important that to carry out your day-to-day activities, you should have enough sleep.
When we were training about 15, 20 years ago, there was no concept of a cap or a burnout for the physicians. We were doing overnight calls, working the next day, sometimes 30 hours straight. Some surgeons were actually putting in more hours than that. So, is there any evidence to show that not getting enough sleep increases the risk of errors, especially if you're in high risk professions like physicians, pilots, or dealing with some kind of complicated machineries, things like that?
Absolutely. Studies over studies have shown increased motor vehicle accidents if you don't have enough sleep, and also committing errors in high equity jobs, stress related jobs, if you don't have enough sleep. Definitely, if you are thinking that you're going to work for 36 hours and catch up on that loss of sleep in the next 7 hours, or there's a concept of catching up of sleep or during the weekends if you're not sleeping enough. So, sleep that is cannot be paid with those weekend naps. Yes, those naps can improve your efficiency temporarily, your cognitive ability temporarily, but long term, that we talked about the neurocognitive and cardiovascular side effects or consequences of that lack of consistent sleep on regular basis would lead to those problems, and committing errors will go up. So yeah, that definitely studies over studies have shown that this is a fact. It's something that you need to be consistent with, that you need on daily basis, and it leads to metabolic dysregulation. Your hormones are your circadian rhythm is upset now, and you're not releasing those hormones at the right time that your body needs them, and the whole homeostasis is disrupted.
Yeah, and that's the goal of our podcast to tell people how to maintain their homeostasis. Hence the name of the podcast. So you mentioned you cannot really catch up on your sleep. So if you're getting 4 or 5 hours of sleep during the week and you sleep through the weekend, that's not going to offset some of the damages that might have been done.
Absolutely. That's what I just mentioned. That short term, you will get your excessive daytime sleepiness will get better. You may do good cognitively for short term, but the long term damage is being done repeatedly. Once in a while, if in 3 years your routine was disturbed for a week, is okay, but consistently doing that is not good for, generally speaking, for your overall health. It is going to have long lasting cardiovascular problems, basically, which stem from dysregulated metabolism, like your blood pressure control, your diabetes control, your insulin resistance, your cortisol levels, your growth hormones level, if you are in that age range. Everything is so intricately linked together that, to simplify it for our listeners, is the increased inflammation that is happening. It's not just happening in one organ, it's happening everywhere in the body if you develop that consistent routine, and it's not good. Go back to that machine example. You want to keep it in that order throughout the life cycle of the machine. You don't want to get it change for a few years and then expect that if you catch up on that timing, you will undo the damage. So you cannot undo that damage done.
So it's like credit card bills. The more you delay it, higher the interest rate, and sometimes it may go to
Absolutely.
collections.
You
So,
got it.
does it matter what's your age? In teenagers and early teens, 20s, you feel like you don't need to sleep enough. You have like tons of things on your mind. You have more energy. You have more enthusiasm for everything. And then in your 40s and 50s and 60s, you feel like you need more sleep or you can't keep up with your daytime work if you're not getting enough rest at night. So, as far as this requirement of 6 to 8 hours, hopefully 8 to 9 hours is concerned, is it specific for a certain age or is it true for almost all ages? Of course, excluding the babies who are sleeping all day and wake up only when the parents want to sleep.
Good question, Ahmed. The duration of sleep that is required for human beings, it varies. When you are, as you said, when you are born, you definitely need more sleep, as much as 22 hours, 20 to 22 hours with newborns, and gradually there is a shift in sleep stages and the amount of sleep you need, and it continues to happen. In preteens and teens, they still require more sleep, and this is important for the growth. This is important for the memory consolidation, for synaptic or the neurons where they're linked together, for the connections to build up. But as we are going into an adult, the requirement is still the same that I told you, 7 to 8 hours. And that's what should be consistently throughout the age. Now, it leads to, in certain categories where you're preteens or teens, then they tend to sleep longer or at times which are not generally accepted or do not align with the societal norms or our requirements. But generally speaking, for an adult, 7 to 8 hours is a good time, is agreed upon timing. For teens, it may be 9 to 10 hours required time, but the timing is also important, what time you are going to bed and what time you're waking up. And I believe we can go into further details about the chronotypes of what time is right, what time is pathological, what time is doesn't align with the societal norms.
If you want to expand on that, please go ahead.
So we talk about always something called 24-hour circadian rhythm. This is out of 24 hours. What time is you needing sleep? What time your core body temperature has to decline? What time your hormones have to spurt? It's all linked with the circadian rhythm. And the way circadian rhythm works is controlled mostly by genetics, and some of it can be modified by environmental clues. So, what is a biological clock? You must have heard. In our brains, there is a nucleus. There's a spot in the brain called suprachiasmatic nucleus, which has certain genes in it, clock gene, for example, PER2 gene, PER1 or PER3 genes. These genes basically dictate how your body should react to environmental cues, for example, light. And based upon that reaction, our body or our brain decides what time is to sleep, what time our temperature has to decline, what time the hormones have to release. And these genes are also now present. We know that from recent research are present peripherally, for example, in salivary glands, and different organs have their own biological clocks, what time they have to do what activity, what time the stomach has to release the enzymes, the hormones at the maximum speed, what time it has to slow down. Of course, these are related to external cues, what you are eating, what kind of diet you are taking in, So these genes basically define how your body will react. And generally speaking, there are three kind of people. One are we call the chronotype is night chronotype, one or evening chronotype, one are morning chronotypes, and one are intermediates. Generally speaking, morning chronotypes are people who are also called morning larks. They tend to wake up early, so they're going to bed early. And there are other kind who actually are awake most of the night and they have difficulty waking up in the morning. So they don't coincide with the natural norm, with the societal norms. We are supposed to get up in the morning, go to work, go to school, go to offices. So these problems we see mostly in teens. Their biological clock is set in a way that the circadian rhythm is pushed. So when I say pushed, it means they're going to be, no matter what you do, they're not going to be able to sleep early. So they're awake till 2 a.m., 3 a.m. But the problem here is aligning with the societal norms. They cannot wake up at 8 a.m., 7 a.m. and get to work. So that leads to sleep deficiency. They will work just fine if you let them sleep till 10 a.m. like you used to be, Ahmad.
I'm still
So
like that.
so this is commonly we see. Now, how much of this you can fix? It is up to some extent fixable. And sometimes with time, these clocks adjust, and sometimes we have to adjust them. For example, sometimes you have to give them early morning bright light therapy to push their circadian rhythm backwards, just like the jet lag. We call it social jet lag to work properly, to work efficiently. And that's why we see these people who are morning larks, they tend to, if you look at the studies in which they have done polysomnographies, the studies on these patients and these people, I will not call them patients, these folks in general population, have seen that morning larks tend to have a longer sleep, obvious reasons, and they tend to have more REM sleep for obvious reasons, and they tend to be more active during the morning sessions compared to our night owls. They tend to have more work efficiency during the later part of the day, and they tend to have same way, they tend to have more growth hormone release, more dip in body temperature towards the later part of the night. And then there are intermediate people, which in which it doesn't really matter what time they would go to sleep, what time they will wake up. Their biological clocks are flexible, or they adjust more to the environment, and or they are just in between. They go regular bedtime at 10 p.m. and waking up at 6 a.m. They just work fine with that routine. But if there's a little bit of change or delay or advancement in their sleep wake cycles, they adjust it rather quickly.
So just to clarify, the people who are genetically night owls, if they are allowed to sleep during the day, they don't get the damaging effects of losing the nighttime sleep. They can still function properly and not have the metabolic problems and memory problems and all the long-term damages of not sleeping at night, as long as they're getting like enough sleep during the day.
As long as they're getting enough sleep, because that's the way their circadian rhythm. But mind you, they will have social loss or privileges in certain issues. So they will, that could be their social learning skills, their academics, their working skills. But talking strictly about health concerns, as long as they are getting enough sleep and they're getting through that circadian, because their circadian rhythm is misaligned to the normal circadian rhythm, sun and night cycles. So they will just work fine, just like in you see in Scandinavian countries.
Yeah. So in the bimodal distribution, what percentage of population is, generally speaking, if you don't know the exact numbers, that's fine, but is it like 50-50 as far as the night owls and day larks are concerned, or is it like a very small fringe
It
population?
is a small percentage, and mostly we see this pattern in teens, and this pattern tends to shift as they grow. Not always, but most of the time, this pattern tends to shift. And the percentage, I don't remember exactly on top of my head, but it is not that high of a number. And mostly we see morning larks here. And as you grow, morning larks tend to be more in older people.
So you did mention REM sleep briefly when you were discussing the night owls and day larks. So let's delve a little bit deeper into the stages of sleep and what is it important for the general population to know about the different stages of sleep, the light sleep, deep sleep? Does it really matter for a common person to know about these things?
Ahmed, it is very important. Up until 1950s, we did not have EEG. So when EEG was discovered, basically we ran into these fascinating sleep stages, how they were classified. And as you just said, there is a light sleep, there is a deep sleep, and then there is a REM sleep. So current classification of sleep stages is stage one, stage two, stage three, and REM sleep. So stage one is basically your stage one and two is your light sleep, and then stage three is your deep sleep, and stage REM is your REM sleep. So stage one, two, and three are also called non-REM sleep. These are one way to look at them. These are just like EEG based classification of sleep stages. As I just mentioned a little while ago, it is not important that how much you are sleeping. It's also important the quality of sleep you are getting. And why is it important that the understanding the classification, there are different things happening during those stages. So for example, the light sleep, your body starts to stop taking environmental cues. So you like unwinding into that sleep, into that stage where your body is relaxing. Not much from memory wise is happening from vital processes that we talked about during the sleep. They start happening when you have that core sleep or deep sleep, which is basically we also call slow wave sleep or stage three sleep, where there is basically neurotoxin clearance is happening. So your glymphatic system is working at its peak during that time. So it's clearing your metabolic neurotoxins or waste products from your brain, which is important for brain to carry out its activities more efficiently. Also, there are some growth hormone spurts are happening during that sleep stage. There are immune system bolstering processes are happening. There are certain processes of your memory consolidation that are happening during that sleep. And then you have this REM sleep. In REM sleep, basically, there are cognitive functions which are being rearranged and being fostered. And also, there is REM atonia that is happening. So, there are vivid dreams that are happening. So, certain pathological diseases, just like REM behavior disorders, are linked to abnormal REM sleep. And during REM sleep, you also have synaptic pruning. During REM sleep, you also have some memory consolidation. Your limbic system, your pre-cortex are being adjusted, their signals are being adjusted, like cognitive refinement is happening, your learning capabilities are being adjusted. So REM sleep, deep sleep, and slow wave sleep or the light sleep are all important for their own because there are different things happening during every stage. So sometimes we see more REM than more slow wave sleep, which is can be an indicator of a pathology in sleep wake cycles. And sometimes we see more of a slow wave sleep than REM sleep, which can be related to. Sometimes we have some movement disorders like parasomnias, which originate from certain sleep stages, like I mentioned, REM behavior disorder linked to REM, and then some other disorders, especially in children, like night terrors, are more originating from non-REM sleeps. So every sleep stage has its own importance and vitality for the appropriate quality of sleep.
So,
Those
just
I can.
just to put it plainly, how many hours of sleep do you need to go through the whole cycle of light sleep, deep sleep, and REM sleep? And how many cycles do you need at night to get all
So
the
individuals vary. REM sleep basically come in cycles, and we have, for example, the whole sleep architecture is based upon how much time it's taking you to fall asleep. It is important. This we call it sleep latency. And then REM sleep has its own latency. So there are ranges, predefined ranges for every age is different. For adult population, if it's taking you 200 minutes to get into REM sleep, that is not normal. If it's taking you 60 minutes to get into sleep, it is not normal either. So it comes into cycles. As you just mentioned, then you go from stage two to stage three, and sometimes you go back to then stage two and then stage three. Sometimes you have awakenings. And then you have REM sleep. REM sleep tends to generally happening into the later part of the night, and then it has to cycle because the cycling is important to carry on all those vital functions, because you just can't have, so usually, and how much REM cycling is happening and how much REM is enough, it varies from person to person, and it really depends on age and sometime on the race and sometime what medications are you taking. Certain medications will suppress the REM sleep and vice versa. So it is important to look at the whole patient as a general entity, what context we are looking at it, what is pathological and what is not pathological. And sleep studies which we do, especially in the labs, we give us with a whole EEG montage, can give you more information about the sleep cycling and sleep stages.
So two follow-up questions on that. So if you keep getting interrupted at night, like some of the physicians who are on call at night, and they get a page every hour, every couple of hours, but they still get 8 or 10 hours of sleep, but with small interruptions, how does that hurt the sleep cycle and the benefits of sleep long term?
So interruptions or sleep fragmentation for one reason or the other is actually would have some effect on the daytime activities. For example, let's take an exaggerated example of sleep apnea, in which there is a lot of sleep fragmentation, or somebody has taken too much alcohol, or you mentioned too much awakenings. It does have an effect on the quality of sleep, basically. And when you wake up, you may feel more tired, not as refreshed as you would have felt without doing so. Definitely, if you wear, for example, an Aura ring or an Apple Watch, you will see it will correlate to some extent to your quality of sleep, how much deep sleep you had, how much REM sleep you had, or core body or core sleep you had. So that will translate into how much groggy you're feeling when you're waking up. Do you have a morning headache? Do you feel irritable? You're not feeling as fresh as you would have felt. And you would have felt me, and you have gone through it for last 2 decades, how much that interruption with those pagers. I honestly, I have difficulty for going back to sleep. And some people they just don't wake up with how much you page them or call them. So it is individualized, but generally speaking, any interruption that you have, you wake up, you may be in REM, you're waking up, and then you may have delayed that cycle again. So it's not natural or physiological.
I
Hope I
see.
answered the question.
Yeah, definitely. And then the other follow-up question on that is, what about these power naps? There's some people, "Oh, I'm going to take a 30-minute, 45-minute power nap during the day," and they come back refreshed and their efficiency improves and they're able to finish the tasks pretty good after taking it. So what's happening in that power nap? Does that compensate for some of the interrupted sleep, or is it just a placebo thing?
I think there is some reality to it, and there is some scientific basis to it. The real important question is, after I answer your question, yes, power naps do work. The real important question is the timing of those power naps and duration of those power naps. If your power nap is 60 minutes, it's not a power nap. So if it's power nap, because the problem with that is you are running into those kind of deep sleep stages. And then waking up from them may carry on to sleep inertia, we call, where you wake up but you're still not fresh enough because you get yourself into that sleep inertia where it can be counterproductive. So studies have shown in roughly 20 to 30 minutes, some studies have shown 10 to 20 minutes on average of power nap. If it's taken the right time, it's not taking it after 3 p.m. or 4 p.m., because that's going to disturb your sleep schedule. So taking it early afternoon and keeping the duration about 10-20 minutes would that has shown actually to improve your vigilance, your capability to carry on your task, your ability to remember things, and your vigilance, basically. So it does seem to help, and it does seem to refresh certain people. You're decreasing their daytime sleepiness and give them a boost. So yes, power naps are true, and I'll go to an extent that I have few patients who we have tested and it worked better for them. Caffeine intake before taking the power nap. And the medicinal basis for that is the caffeine takes about 15 to 45 minutes to kick in. That is the onset of action. And if you take caffeine and then take that power nap for 20 minutes, 30 minutes. By the time you're waking up, it's not only you are having that the stage one sleep where your body has to relax, and now the caffeine has started to kick in. Works better for some of my patients. But again, timing is important and the duration is very important. And do not make it a habit. Remember, we talked about that you cannot pay the sleep debt. So every now and then, if it happens, it's good to, especially with those interruptions during your sleep, which should not be a case for daily basis.
Excellent. So we were going to discuss some of the things that help you sleep and some of the things that can hurt your sleep in the second session. But now that you mentioned the caffeine, let's just finish that subject and then we can end this session. Our second session is going to be talking about things that can help your sleep quality, things that can hurt your sleep quality, some foods, some fads, and some of the sleep disorders, and when to seek care from a sleep expert like Dr. Tashfeen to make sure that you don't have any medical issues that are interrupting your sleep, and it's not just your habit or just your routine. So let's, because I know you're a big fan of getting coffee yourself. You have 3 or 4 coffee machines at home. Does coffee help, hurt? How to use it? How many cups of coffee a day are okay? And when it starts becoming a problem with your sleep.
Thank you, Ahmad. Yes, I'm a big fan of coffee. Brew actually my own coffee every day in the morning. We get some beans and try to get them fresh. Yes, as you mentioned, caffeine does help in keeping you awake. I will not go into details. It has been shown that right amount of caffeine is actually good for your overall cardiovascular health and metabolism. But just staying on sleep, caffeine, there are certain neurotransmitters which are released in the brain throughout the day. And that takes us back to the natural homeostasis. As the neurotransmitter called adenosine rises in the brain, it actually helps us sleep. And what caffeine does, it basically blocks those adenosine receptors. So it doesn't let us sleep. So, yes, coffee makes me fresh. If I don't have caffeine on my time when I'm supposed to have, I will be drowsy. I will not be as active as I want to be, and I would have probably rebound withdrawal headaches. Excess is always bad, and the timing is also important. Then, as you, I don't want to drink coffee in the evening or in the late afternoon because I have tried it and I know that it would disrupt my sleep. Studies have shown if you take, for example, a double espresso 3 hours within your sleeping time, it does reduce your REM sleep. It increases your sleep latency, decreases your sleep efficiency, and does cause more sleep fragmentation, just like alcohol does. So, yes, the right timing of caffeine is good, and try to avoid it in times where it can disrupt basically your natural sleep, because it's gonna mess up with your melatonin secretion in your brain and can mess up with your circadian rhythm. Your morning caffeine does work for me, and it does work for most of the people, and studies have shown it does keep you more vigilant if you take it in the morning.
But can it compensate for lack of sleep at night?
Again, there is no compensation for lack of sleep for nights. So yes, that 7 to 8 hours, sorry, sleep, 7 to 8 hours sleep is vital. Now, again, when I say 7 to 8 hours of sleep, it's general population. You may come across with certain patients or certain folks who would tell you, "Oh, I sleep 6 hours and I just do fine." Okay, the brain may be vigilant enough, but generally speaking, large cohorts of population studies, epidemiological studies have shown that it does have cardiovascular increased comorbidity risk if you are not having enough sleep.
I remember seeing an observational study like more than a decade ago where they saw that athletes who were getting less than 6 hours of sleep had a twofold or threefold high risk of injuries the next day when they were playing some sorts of professional sports. But I'm more of a tea person than a coffee person. I've realized over the years that the tea has lost its effect. I could drink like a bunch of tea and still go to bed. Do you develop tolerance to caffeine over time, or it's not? There's no adenosine escape happening after a few years of excessive coffee use? Does it stop working after a certain amount of time?
There is some evidence. There is some evidence behind that. Tea is, I will tell you, my mother, she drinks about 12 to 14 cups of tea every day.
Wow.
And I'm not exaggerating. And in our culture, we drink a lot of tea. People, especially our moms and
Have
aunts, They wake up, they need a cup of tea. They have to go to bed, they need a cup of tea. They have backache, they need a cup of tea. They have headache, they need a cup of tea. They have to get out of bed, they need a cup of tea. So, yes, tolerance does seem to develop. And I have noted in even in myself, I have tried it. The more I make my body dependent on something, the more I start relying on those things. Especially, we recently had a month, you probably know Ramadan. We were all getting less and less sleep. So we were trying to compensate that with certain things like drinking coffee early morning and drinking more than what we want to. But definitely caffeine has a half life roughly 5 to 7 hours. So after that you are going to have that dip, and if you do not have that enough sleep at nighttime, you're gonna go back into that urge to get more. And I have tried to do it like getting second cup in the late morning, maybe 10, 11-ish, or maybe even noon. And the more I do it, the more I want to do it next day. But the more I don't do it, it's easily doable. But then again, if you're drinking more than that, there has to be another problem that we need to look into. And you need to probably see a sleep doctor.
Perfect. So let's take a break here. I'll give you maybe 5 minutes for a power nap, and hopefully we can meet in the next session, discuss some of the more fun stuff, things to help our audience sleep better, some of the tips and tricks that you might have used, and see if we can use some over-the-counter recommendations for folks who want to get a better sleep and be more functional in the morning. So I'll see you in the next session. Please don't forget to join us for the next episode of our Sleep Medicine Homeostasis Podcast with Dr. Mahmood. Goodbye for now. Happy living and happy learning, everyone. Bye.